Good morning everyone. I am Jatinder Kaur from Khalsa College of Nursing, present here to discuss about the pneumonia with you people. Pneumonia is the infection of the lungs which leads to inflamed air sacs which is filled with the fluid and pus in it, which causes the difficulty in breathing. Pneumonia is a life-threatening condition. It can be threatened to anyone, particularly infant, children, and the people over the age of 65 are at the high risk of getting pneumonia. Pneumonia is so contagious and is more particularly present in the people during the winter time. According to the report, in 2020, about 2.3 crore people are diagnosed with acute respiratory infection, and because of the same, about 5,000 people died. In the same year, about 4 lakh people are diagnosed with pneumonia, and out of which 4,000 are died because of pneumonia. Next, we will discuss about the signs and symptoms of pneumonia. The signs and symptoms of pneumonia may vary from mild to severe, depending upon the factors like age, the causative agent, and the health status of the person. Mild pneumonia or mild signs and symptoms, the patient may have a similar symptoms as in common cold and flu. But in pneumonia, it may go longer. Let us discuss about the signs and symptoms. Patient may have chest pain while coughing, while breathing. Patient may feel rapid breathing, shortening of breathing, difficulty in breathing, rapid pulse, vomiting, nausea, diarrhea, fever, chills. So these are the signs and symptoms of pneumonia. Children may not feel the same signs and symptoms. They may have fever and vomiting. Let us now discuss about the diagnosis of pneumonia. When we are going to the doctor, doctor may assess the physical symptoms first. And to confirm the diagnosis of the pneumonia, may ask for the various tests. In this, the first test is the chest X-ray. In the chest X-ray, the patient may get inflamed lungs. Doctor may ask about the blood test, that is CBC, complete blood count test, in which the white blood cell count may increase. Next is the chest CT scan. Next is the bronchoscopy. In bronchoscopy, a flexible thin tubing is inserted in the lungs to assess or to check the bronchioles directly. Next is the pulse oximetry test. In pulse oximetry, the oxygen level in the blood may found reduced in the pneumonia patient. Now, let us discuss about the types of pneumonia. The types of pneumonia is categorized on two parts. The first, it depends upon the causative agent. The first is the bacterial pneumonia. It is caused because of the bacteria. It can coincide with the sinus infections. The patient may have an ear infection. The patient may have a meningitis also with it. In meningitis, there is an inflammation of the meninges, and it is more serious condition than the other causative agent causing pneumonia. Then is the virus pneumonia. Virus pneumonia is caused because of the viral infections. In virus infections, the patient may feel the symptoms same as the common cold and the flu. Then is the fungal pneumonia. Fungal pneumonia occurs because of the fungus infection, and this is very rare. It occurs in the patient, those who are very compromised with the immunity. Now let us discuss about the various stages of pneumonia. The stages of pneumonia, first is the stage 1, that is congestion. This occurs within 24 hours of pneumonia. In this, there is the availability of WBC in the lungs and the bacteria in the lungs. But to fight with the bacteria, WBCs are present. Because of the high flow of the RBCs in the lungs, the color of the lungs may be red in color and are inflamed in nature. The stage 2 is the red hepatization. In red hepatization, it will be occurs within 2 to 3 days. In the red hepatization, the person may feel dryness in the lungs. Patient cannot feel, we can assess. There is a dryness in the lungs and the lung look like a airless thing. It resembles like a liver. The debris in the lungs present are clogs the airway, which causes difficulty in breathing. The third stage is the grey hepatization. In grey hepatization, the color of the lung looks like grey. In here, the RBCs break down, which causes increase or excess in the fluid in the lungs, which again causes difficulty in breathing. Stage 4 is the resolution stage. It occurs after 8 days. The patient may feel relaxed with the symptoms, and the various debris and the fluid present in the lungs get reabsorbed again in this stage. Now let us discuss about the occurrence of pneumonia. The pneumonia can occur in the 4 areas. First is the hospital-acquired pneumonia. Hospital-acquired pneumonia is caused while we are providing the care to the patient by the healthcare providers. The person may get infected from there. Second is the community-acquired pneumonia. As the name suggests, we are getting the pneumonia from the community area. This is more severe and dangerous in nature than the hospital-acquired pneumonia. The third is the ventilation-associated pneumonia. The person who has the difficulty in breathing can get on the ventilators. The person may get infected from the infected mask in the ventilator areas. The fourth is the aspiration pneumonia. In the aspiration pneumonia, the person may get aspirated the solid things or the liquid which goes directly inside their lungs, which causes pneumonia among them. Now let us discuss about the diagnosis. For the diagnosis purpose, the doctor may firstly assess the physical symptoms in the patient. Then he may ask for the various tests. The first is the chest X-ray. In the chest X-ray, the patient may have inflammation in the lungs. Then is the bronchoscopy. Here, the flexible tubing is inserted inside the patient to check the bronchioles directly. The next is the chest CT scan can be asked by the doctor. Pulse oximetry can be asked by the doctor, in which there is a reduce in the oxygen level among the patients. Next, the doctor can ask about the CBC blood count. Now let us discuss about the treatment of the pneumonia. As we have discussed, it can be caused because of the various microorganisms. These microorganisms are bacteria, viral, fungus and the parasites. So as the treatment is also given according to these. If the person is having a bacterial pneumonia, she is treated or the person is treated with the antibiotics. On the other hand, if the person has a viral pneumonia, then the person can be treated with the antiviral medications. Same in the fungus. If the person is having a fungal pneumonia, the person may be treated with the antifungal medications. Other than these, various symptomatic treatments are given to the patient. If the person is having difficulty in breathing, the person is given with the oxygen therapy. If the person feels fever, treatment for the fever is given to the patient. On the other hand, if patient feels diarrhea, vomiting, the same treatment is given to the patient according to the sign and symptoms. But on the other hand, if the patient is having a excess of fluid in the lungs, then the drainage is done on the patient to remove the excess fluid from the lungs. Now let us discuss about the prevention, which is the most common and most important part of this talk. The pneumonia can be prevented with the immunization. There is a provision of the immunization or the injections for the prevention of pneumonia in our hospitals. The child must be immunized with these injections, and other viral immunization must be given to the children. We can change our habits, we can change our behavior habits so that we can prevent it. In this, the first prevention can be done by quitting the smoking. As we discussed, this is a respiratory infection. The person must avoid the smoking. We should wash our hands before eating and before making food. To stay healthy, we must have a balanced diet. We must have a exercise regularly. We should go for the yoga and the various exercises so that we should stay healthy. So nowadays, as the common cold is very common and the flu is very common according to the weather, so we must distinguish between the symptoms of pneumonia and common cold. As we have discussed, the symptoms of common cold and pneumonia are same, but the symptoms of the pneumonia go longer. So if any person feels the symptoms are very longer among them, then they should consult a doctor to check for the pneumonia. Stay healthy. Thank you.